Hi there, everyone. Thanks for joining us. I'm having an awesome conversation with Helen O'Farrell today, who's just completed our 4-week persuasion program. So to share with me, I'm going to ask Helen a couple of quick questions just to get a bit of feedback on her experience. So Helen, can I ask you, what was it that encouraged you to jump into doing this program? What was the problem that you faced before joining our persuasion program?
Well, I was very aware that, I'm an RN. I'm a nurse.
Yep.
My job revolves around being very clinical. However, there is a sales idea to what I do. And I know that that was my downfall, particularly with the right sort of language to use, because I've always been quite apprehensive of coming across really pushy, like that pushy sales rep, because I've experienced it.
Yeah, and most nurses I talk to have exactly that same fear and phobia because it's not part of the protocol. It's not part of the way that you're educated to operate.
That's right.
So I really respect that. Out of the program, what were the big things that jumped out to you after doing the 4 weeks? What have you found? And what would be some of the things you would say to others?
Oh, look, I think it's fantastic. It's given me some great language to use, particularly, and I use the last session that we did with the closes. It just comes back to the language, really. The other thing with it as well, it's made me sort of step down from that, how you sort of operate on that unconscious competence stage, where you get into that, habit, you're just doing that, but you're not really thinking about what you're doing. So what this course has done is sort of encouraged me to step back and be more conscious of how, things I'm saying and how I'm carrying the consultation, so to speak. Yes.
Right. Okay.
And then from there, I can then drag in sort of input things I've learned from the course.
Good. And other people may choose to listen to our conversation today. What would you say to them if they were in a similar position to you and or contemplating doing this program?
Oh, I'd say get right onto it. And I think it's value as well. Like I've looked into other courses that have been sort of thousands of dollars, whereas I think this is really, really good value for your money. And you will definitely take away strategies that you can implement straight away into your practice.
That's fantastic, Helen. Thank you. Thank you very much for being so open and honest and just sharing some feedback. I know everyone will appreciate it.
You're welcome.
Thank you very much.